Of course, we're going to get into mental health because as a mental health therapist, this matters. Let's talk about it. With cuts in Medicaid and food stamps, millions of Americans may lose access to mental health care. Stress around losing health care, finding affordable food, and housing can lead to increased anxiety, depression, and emotional burnout. Let's also remember how there's countless of children who depend on SNAP to eat during the summer and throughout the year. And if long term care facilities or nursing homes face closures, that may leave families overwhelmed and unsupported. Welcome and welcome back, friends. Today we're going to talk about one of the biggest bills passed by the House in 2025. A bill that could shape everything from your taxes and healthcare to border security, artificial intelligence, and even your mental health. In this video, we'll break down what's in the bill, how it could affect you and your family, and what to know about the financial and emotional impact. It's important to also know how to prepare wisely for the road ahead. So let's get started. So the first thing I'm going to talk about is tax reforms. This bill brings some major shifts on how we're taxed. For instance, many working Americans, they're going to have some relief. For example, those who get tips and overtime pay no longer will be taxed at the federal level. Seniors, there's a 4,000 increase in the standard deduction starting in 2025 and lasting through 2028. Let's talk about families. The child tax credit jumps to $2,500 per child. And if you're looking to buy a car, you can get a 10K tax credit for purchasing an American-made vehicle. Sounds helpful, right? But here's something to keep in mind. Experts say that this bill could add up to $5 trillion to the national debt over the next decade. So that's not really looking great, especially when considering the next generation. That means we may see changes in federal programs down the line. So it's important to stay informed and plan ahead. Now let's talk about healthcare and social programs. Okay, especially social services. This part of the bill has raised some concerns. Why? Because let's consider that there's a 1 trillion cut to Medicaid funding. This could affect healthcare coverage up to 14 million Americans. The bill also adds tighter eligibility checks and new work requirements for Medicaid and SNAP, which could impact 3 million households receiving food stamps. And under budget rules, there would be automatic cuts to Medicare, totaling in 500 billion. These changes might not affect everyone today, but for low-income families, seniors, and people with long-term medical needs, the future could feel less insecure. Now, more than ever, understanding your healthcare options and staying prepared is key. Let's move into immigration and border security. This bill also makes big investments in border and immigration enforcement. Over 150 billion is allocated over the next 5 years. And I'm wondering who's paying for all this. Here how it breaks down. 51 billion for border infrastructure, 59 billion for detention and deportation operations, and funds to hire over 18,000 new ICE and Border Patrol agents. It also increases detention bed space from 41,000 to 100,000. Supporters say this improves national security, but critics worry it could lead to human rights issues or due process concerns. No matter where you stand politically, right, red or blue, this is a major shift in how immigration will be handled across the country. Moving on to technology and AI regulation, the bill also touches on the fast growing world of artificial intelligence. It puts a 10-year moratorium, meaning a freeze on any state level laws about AI. All regulation would now come from the federal government. That could help create consistent national rules, but it may also slow down how quickly states can respond to new technologies. If you work in tech, education, or policy, this is something to keep a close eye on. Mental health is not just a personal issue, it's a community issue. And now is the time to check in on your well being and support those around you however you can. So, no matter how this bill affects you, there are a few ways to prepare. Here are 5 smart financial steps to take right now. 1, review your budget. Look at what's coming in and what's going out. Okay. Small changes can lead to big results. I remember a friend of mine who would go to Starbucks literally every day. And she said, you know what? I'm going to make my own coffee. And that money that I'm going to use daily, I'm going to save aside. And at the end of the year, she saved for a vacation. 2, build an emergency fund. Try to set aside 3 to 6 months of living expenses. Start small if you need to, just to be consistent. 3, understand your healthcare options. Whether it's through an employer, the marketplace, or local clinics, make sure you know what's available. Number 4, stay informed. Policy changes can happen fast. Okay, you just blink and there's headlines. So follow trusted news sources and talk with a financial advisor if you can. Check to see if there's nonprofits in your community that offer free financial advice. Please. Number 5, don't be afraid to ask for help. There's so many online tools that can guide you through, but if you don't ask, you don't know. Know this, that you are not alone. This bill, big and complex as it is, will impact real lives in real ways. And some parts may bring relief, while others, new challenges and burdens. But the more we understand, the more we can prepare. Let's take this moment to live not in fear, but with action. Check in with your mental health, talk to your family about finances, and most of all, keep showing up for your future. If this video was helpful to you in any way, kindly subscribe, like, and comment, and definitely share with a friend. Much love.